Hello, this is Dr. David Pomeroy, the host of ADHD Focus. I'm glad you could join us for today's episode. And this is, I think, a intriguing topic and one that has not yet gotten enough attention, and that is the female ADHD tax. Girls and women with ADHD and how it is underdiagnosed or misdiagnosed. And my guest today is Deborah Brooks, a psychotherapist in Ottawa, Canada, whom I met at the recent CADRA conference in Montreal. And she has studied this area extensively. Deborah, welcome to the program.
Thanks, David. Nice to be here. I'm quite excited.
So we will be talking about kind of expanding on this idea of the female ADHD tax and how it comes about and what it involves. So, Deborah, how did you come to that? I guess that name for it.
Well, I started my interest in this began from my awakening of kind of what ADHD was, and I started to notice it more and more in my office. And I was seeing, now I do predominantly see females, but I was seeing the effects of undiagnosed ADHD in women. They were underemployed, struggling financially, broken relationships, single moms, and just really struggling. And what was devastating was the really poor self-esteem. And it was a bit of a light bulb moment for me. And if we want to make any progress, that has to be addressed. So I started to look into it further and do research. And I am actually doing a master's in public ethics right now. And I'm doing that because I want to write about mental health in a way for other people outside of the mental health profession, right? As people don't know, they don't understand. So this was something close to my heart. I also have ADHD. And, I haven't made the most practical decisions in my life. I've made decisions for peace, and sanity. But, and I do have a group of female psychotherapist colleagues, all have ADHD as well. And we started to talk about this topic. And we all had very, very similar experiences. And so there's really something to this. Started to do the research, and there is a lot of research out there on this topic. We have known for a long time. The big difference is boys are diagnosed 4 times the rate of girls. And that's because it presents differently, sure, but also the different social expectations of girls.
I think that the stereotype in most people's mind is young hyperactive boys have ADHD and they grow out of it by the end of high school. 50% of people who have ADHD have the inattentive type and are not hyperactive at all. And certainly girls have it. It'll be interesting if ever all the misdiagnosis comes up to not being made as much, are girls as likely as boys to have it? Because all the research has been on times when girls and women haven't been diagnosed.
Yeah.
And then the hyperactive part, yes, you're socialized to 10th grade. You don't get up and start walking across the classroom, and maybe you're talking a lot or interrupting, but you've probably learned to not do that. Or you're in sports, you're in a lot of active things that mask the hyperactivity. And adults are are still hyperactive in many ways, so it doesn't go away.
It does not. I think I read something recently that 90% of children with ADHD, it progresses throughout life or
Yes,
continues.
there
Yeah,
are some that seem to really outgrow it. Many at age 30 may not have the full criteria. Okay, they have 3 fairly identifiable of the 9 criteria for ADD, but they're still impaired by it.
yes,
There's a
yes,
subclinical area there.
yeah, where there's still impairment.
And
Yeah,
then also looking at the strict diagnostic criteria, that misses a lot of things. It misses the whole emotional regulation side, and specifically misses a lot of things that women, that girls would identify as, oh yeah, I do that. Well, okay, that's very typical of ADHD.
yeah, I was thinking the big one that isn't in the criteria that a lot of women experience is this rejection sensitivity dysphoria. And that is
Mhm.
from a lifetime of being told, what's wrong with you? Try harder if you, applied yourself.
Mhm.
And and then also not learning the social cues or knowing what's wrong and
Yeah.
talking too much, not listening. They have significant impairment in relationships. And then at some point, they just expect rejection.
Mhm.
So that
And
is, yeah,
yeah,
huge.
it's definitely common. Whether it in men, it may be more. No, I'd be speculating, but certainly if one perceives, someone with ADHD perceives being ignored, rejected, discounted, bang, either angry or depressed.
Yes.
Turns it inward. I'm bad. I made another mistake, or
Yeah.
you attacked me. And it may have been something as simple as, did you empty the dishwasher?
Yes. Or even a positive social encounter
Hmm.
with friends, they will ruminate over for days after, assuming they must have done something wrong when maybe they haven't.
Okay.
Yeah. Just that heightened self-consciousness that they can never do or say anything right.
And
Damn.
it strikes me in looking at a number of the questionnaires. For instance, Sari Solden came up with one that is a screening set of things for women specifically, and Kathleen Nadeau for girls. And many of the ones that Sari came up with were about kind of the being perceived as not socially acceptable or up to speed. Are you afraid of having, or you don't invite people over your house because you're ashamed of the mess,
Mhm.
or you don't get thank you cards or birthday cards out in time, and because you're disorganized and maybe you have 2 kids and a job and everything else to take care of. Um, but that's not something a man would worry about
Right.
in terms of, well, guys are going to be used to seeing stuff around. As long as the table in front of the TV has room for the snacks and the couch is clean, then great, we're good. And
Yeah, it's
so that's
true.
a difference in the stereotype, but I think it holds true.
Well, it is a stereotype, and then I think in the changing gender roles, some things have not changed completely yet. If you go to someone's home to visit and they are married, the expectation is that the wife is and should be doing these things. And if it isn't that way, it's her failing, you know? And I think the same thing with childcare and a lot of those things still.
Mhm.
I related to the card one, like when we were speaking earlier, that I read that in the questionnaire and I laughed and looked at my pile And I have just started to send them out late now. Better late than never. But yes, my
Yeah.
husband doesn't feel the desire to send thank you notes. It's just not something he was raised to do. But as a
Mhm.
female, you have to show that gratitude and reciprocal relationships.
Right, and almost the female has the responsibility of the household to write the thank you note.
Yes.
That's the expectation, so that the social expectations, which girls certainly feel, at least judging by the questionnaire that Dr. Nadeau came up with, feel socially ostracized and don't know how to fit in, feel like they don't fit in. Boys
Yes.
may feel the same. And I think that's the inattentive, whether it's in girls or boys, gets missed because it's not obvious.
Yeah.
One physician here in the Seattle area, whose work was all in ADHD, made a videotape with girls and boys and teenagers about their ADD. And he asked the girls, do you daydream in class? Oh, all the time. Would the teacher know it? Oh, no, I'm not dumb. I'm looking at the teacher.
Yes.
And
Yeah.
boys aren't even bothered with that. They're obviously looking somewhere else and just spacing out. So the smart try to fit in masks some of the behaviors that otherwise would be seen as, oh, this is pretty much ADHD.
Yes, as girls, so much importance is put on how we look and how we present. And
Mhm.
so, yes, to fit in normally, we're going to want to look a certain way and we're going to present in a certain way. Even if it's difficult, we will do that.
Mhm. So then there's the masking. I see, and I've seen it enough to know it's a very typical pattern of girls who are bound and determined they are going to finish the homework. And it's not just because they're perfectionists, but some are, but they will be up till 1 a.m. finishing homework. So then they're sleep deprived because they have to get up at 6:30 or so. And so they get great grades. Well, you couldn't have ADD. You've got good grades. Yes, good grades, but two tutors and 5 hours of homework, and you aren't involved in any social activities. Boys give up by 7:30 and hit the video games or whatever. So girls are masking it.
Yeah, they'll work much harder to hide it and to fit within a normal, what they perceive as normal.
Mhm.
And to not get criticized, avoid criticism. Because they're
And I
getting
think a lot of perfectionism in girls or in boys is, if I'm perfect, if everything exactly right, I can't be criticized. And that, I think, goes back to the criticisms as ones even up to before 5, 6, 7. You can't do anything right. How can you can't do this? You don't remember things. You're losing things all the time. Your brother never does that. And it goes on and on. So how do these kinds of things manifest as the female ADHD tax?
So if we look at a girl that isn't getting diagnosed and has it, she is picking up with those messages. She's working very hard to get to a certain point. But in not getting diagnosed, she's not finding out what her deficits are related to the ADHD. So does she have a processing problem? Does she have a memory problem? All of those issues. And at some point, typically within the school system, she's going to hit a ceiling of what she's able to do or not do to continue, right? So typically, they're less educated, undiagnosed females, and then the job prospects are affected by that. and underemployed and not making what they might if they had been able to work with this disability, you know?
And then if they have children, whether they want them or not, then
Yes,
that further takes them out of the job market or possibilities in jobs,
yes.
or getting further ahead in their education.
And 10 times more likely to have unplanned pregnancies. And you
Hmm.
can see how that could happen socially, you know, if that self-esteem persists and the shame, they're looking for attention often in the wrong places and vulnerable to unwanted attention as well.
And it certainly could be, did I take my pills this day,
Yeah,
week, whatever?
yes.
Because the birth control is often assumed or supposed to
Mhm.
be on the woman in a relationship. And
Yeah.
if she's forgotten the pills, then there's a problem that it certainly could lead to a pregnancy. So, and this is the forgetting and just putting that not intentionally putting it aside, but it's on, and everything's on the same level of importance. And this is true for anybody with ADD,
Yeah.
unless one specifically looks at the things there are to do and puts a priority on them, well, they all kind of have equal weight.
Yes.
Um,
Yeah. Exactly. Can't prioritize well or advocate for themselves, or, you know,
mhm.
if the government might just say, oh, okay, if you promise, you know. So that's a big problem. And then having children with less resources, so it's unlikely they'll get diagnosed, and then it's just this vicious circle. Um, and I think we talked about how when you have kids, the need for executive functioning goes way up because you're
Well,
managing
yes,
home
absolutely.
and children. And that is often a very, very difficult period for anybody, but especially women with ADHD,
Mhm.
undiagnosed,
And
unsupported.
I think there are some, and I'd say the exception, where it's evident that husband and wife, man and woman, are discussing and looking at how do we divide up the tasks. Okay, you're going to get kids ready for school and do the morning stuff, and I'm going to do the afternoon or whatever. But more often, it's, well, dad's off to work, getting kids dressed, that they have lunch, get them out to the bus. That's all things moms are doing. Um, and, or they're the ones, maybe dad takes a child to childcare, but then mom picks up. Well, mom has to leave work early, uh, or has to bustle around and try to get kids all set and to the childcare in time or to school in time so she can get to work. But one or more of her children may well have ADHD, and that's a struggle for anybody
Yes.
to get a child with ADD ready to go to school.
Oh, isn't it just so challenging? Yes. So yeah, and you know, the misdiagnosis piece. So a woman, by the time she gets to, let's say, 30, and maybe she has a kid or two, she probably has been misdiagnosed, or maybe not
Mhm.
misdiagnosed, but with depression and anxiety. So she may be medicated thinking, oh, that's the issue, and it might
Mhm.
not really effectively treat it, the medication, and
Mhm. Sure.
compound the problems, really, in some sense.
Yeah. And I think many people, particularly with depression, well, what's wrong with me that I'm not getting better? I'm not doing something. This medicine should help. Well, we
Yes.
know medicines don't always answer. often don't answer fully everything going on with depression.
Mhm.
And I have seen more women than men that come in and, yeah, I'm on a medicine for anxiety. And yes, they're anxious because they aren't measuring up and they know they aren't in all the various areas that someone with ADD is expected to.
Yes.
And I'd say, okay, after an evaluation and looking at everything, yes, I think you have ADHD. Let's, if you choose to take medication, let's try that. And she'll come back in 2 months and say, I don't need that anxiety stuff anymore.
Right.
It was ADHD. Sure, many
Yes.
people do have generalized anxiety disorder as well as ADHD co-occurring, but
Mhm.
many times, and usually it's a woman that, oh, I don't need the anxiety. Then she's been misdiagnosed with anxiety when the background is the ADHD. And I think often the reason a mom comes in to have an evaluation is because one of her children was quite definitely has it, or a friend says, you may want to look at this because my teenage daughter just got that, and I was learning more about it, and I know you pretty well, and
Mhm.
so that's the way a woman comes in, not because it's been recognized at school. Certainly, I don't think workplaces recognize ADHD as an issue, much less suggesting to someone they get an evaluation. Every once in a while, I hear that, yeah, my boss suggested it. I don't think anyone wants to suggest to their boss that they have it.
Yeah,
Uh,
exactly.
it doesn't work in that direction.
Yes.
But the misdiagnosis is definitely there. Or, okay, you're someone who has the rejection sensitivity. They
Mhm.
get angry. They have this mood variation. Oh, you're bipolar. They're
Yes.
put
Yeah.
on medications, and then that label carries through.
Or borderline, the emotional
Hmm.
regulation. So, for me, I don't know that I ever would have been diagnosed if my son hadn't. And what is interesting in that piece too is he has the same kind as me, the inattentive. So it was the zoning
Hmm.
out, it was the processing that the school noticed. He was spotted and diagnosed. And I was reading some literature by teachers associations, and they actually say for the most part, boys and girls do with ADHD present very similarly, but the way the girls will be dealt with is different.
Hmm.
It's treated as a behavioral problem, and with the boys, it's treated more as a neurological problem, right? It's a very different approach.
Yeah. Um, and I think in schools, they do tend to focus on the behavior,
Mhm.
not if someone's frustrated at themselves, I can't um, figure out things on this test. I'm going to get behind them. I'm not going to do well. And one boy, I think he was in third grade, and he just got so angry, he threw his pencil down. Well, the teacher interpreted that as violent behavior and emptied the classroom, and they had to come
Oh
up
my
with this
goodness.
behavior management plan for him, and totally missed the boat. And I think with girls, it's, well, you were upset, and yes, you're moody, um,
Mhm.
and I'm sure from what I've heard, I can't be personally assured, of course, but that women are more moody in the week before their period and have PMS or PMDD, the
Mhm.
depressive dysphoria, depression,
Mhm.
and that can be an excuse. Oh, okay, it must be your time of the month. No wonder you're
Yeah.
upset or whatever. Um,
But not
and
think about the link between the PMDD and girls who have ADHD.
which
And
is a higher percentage of girls with ADHD have PMDD
yeah.
than not.
Hmm. So, there are lots of ways along the lifespan that this is difficult. And the next one is the perimenopausal and menopausal women.
Mhm.
Huge spike in symptoms around menopause, which in some sense can almost mimic ADHD with even if you don't have ADHD. So for the
Right,
women
right.
who have it, it is really destabilizing, can take us out of work,
Yeah.
and
And
functioning.
that, the drop in estrogen, is a lot of that because estrogen, it turns out, helps dopamine function better. So if there's lower estrogen, then that dopamine connection isn't working as well. And it can be off enough, even if someone does not have ADHD.
Yeah.
But definitely some women will say, yeah, my medicine, it seemed to be doing pretty well, but it's not working. And
Yes.
some women, even with the estrogen drop every menstrual cycle, they need to take, or one way to deal with it is take a little bit more medicine that week.
Mm,
But at the same time, there's that cost of the moodiness and things, which is, yeah, the ADHD part fits in there, particularly when it magnifies these other things.
yes. Yes. And
So,
very difficult at that age to tell what is the difference here. What is
mhm,
you really need a good life review to see how it may
yes,
have played out. And I was mentioning that here in Canada, that's very, very difficult to find now with primary care physicians. You could get a psychologist or a psychotherapist, but they cannot diagnose. The psychologist can diagnose, but they cannot medicate. So there's
mhm,
just these barriers. And then if we think about a typical woman with ADHD and how impoverishing having this undiagnosed disability can be, a full assessment here costs in the range of about $3,000.
oof,
Yeah, and now if you're well employed and you have insurance, you can likely get some of that covered, but that's a lot of money to spend. And
yeah. And what I see in this country, and I've been surprised recently, people say, yeah, I can't get an appointment with a primary care for 3 months. Um,
yeah,
and that's if you already are established in that practice or no, they aren't taking new patients. And so to me, it comes down to a aspect of time. It takes time to really dig into details in making a diagnosis of ADHD, sorting out these kinds of things. Some positive answers on a screening test do not equal
no,
the diagnosis.
no,
And there certainly are not enough psychiatrists to do all those evaluations, much less help people with bipolar and schizophrenia and everything else.
the other, yeah,
So in both Canada and the US, there's this shortage of physicians, clinicians who have the time to diagnose. Unfortunately, some of them also skip over. Well, you've got a college degree, you couldn't have ADD.
yeah,
Um,
yeah,
you're a professional, you're an attorney, you're a physician, whatever. That isn't going to be what's going on with you.
yeah.
So
Or,
that
or even just
having to
you're an
count that.
adult. If you had ADHD, they would have spotted it when you were a child, not for
Mhm.
girls to have, unless
And I,
you presented like a boy, you know, and were
mhm.
bouncing off the walls, maybe. Hmm.
I'm, and this is just a speculation in terms of if the male in a relationship in a marriage has
Hmm.
ADD, well, he's more likely to have a lower paying job or shift jobs more often.
Right.
And if his wife does not have ADHD, well, and she's got to deal with that plus children. So there's almost an indirect tax that she's paying maybe on her career and having a relationship that's not working because the male has it. If both of them have it, boy, that's a mess. It can be.
Yes, yes, it can be. So, yeah, the other piece I'm just thinking as you're saying that, this ADHD can make women dependent, on their partner, on the structure, on the finances, on the just being able to do what needs to be done. And so I think about Dr. Barkley. I watched one of his talks recently, and he was talking about how if we could just, if physicians would just accept that this is a real thing, besides depression and anxiety, and maybe explains it, it is the most treatable mental health problem, most treatable and possible to normalize with medication, far more than any other psychiatric condition. And
absolutely.
So it's that is often my objective in my work, is to help people figure that out and get the right resources and the support in the meantime, and to build up self-esteem that has been devastated over a lifetime.
And I think in terms of their support, data and here in the US, well, Canada, anywhere, and Attitude Magazine have webinars. That has a lot of support groups of people in different situations, families, college kids, LGBTQ, any of those kinds of things. We don't have any organization like CADRA and CADEC where professionals in Canada decided we need to educate other professionals about ADHD. And is it 16 or 17 years ago that started, and we have guidelines for diagnosis and information about diagnosis, but then it's education arm for anybody, school, teachers, public, someone who's has a relative with ADHD, so they can learn more about it.
Well, and
now physicians would take the time to not think it's non-existent. What I've seen, and I'm not too surprised, unfortunately, that many, particularly primary care docs, they don't want to have anything to do with stimulants, and because that's a Schedule II medication, you get addicted to those. Part of it, I think, stigma, they lump it together with the opioid crisis, and I'm just going to have all these drug seekers and everything. There are fewer than 10 people in my practice, 18 years, and over 3,000 people with ADHD that have, or patients, most of them have ADHD. Very few are seeking amphetamines. And I don't think someone truly well diagnosed actually has ADHD is at risk for getting addicted to amphetamines or methylphenidate. So amphetamines are more common because if they take more than works, it does not feel good. There's no euphoria. It's a negative feeling. So there's no incentive to take more and more. So yes, they are addicting substances, but very, very unlikely to be addicting to someone with ADHD. But that stigma of, you don't want to, the doctor, I don't want to be involved with prescribing amphetamines to someone. And patients, no, I don't want to take those dangerous drugs. Well, it's much more risk to not take it than there is to take it.
Yeah, absolutely. I think still my understanding is the majority of people even diagnosed with ADHD do not take medication for it. I think it was about 12 to 20% of people with the
Mhm.
diagnosis take medication, which is internalized stigma, right? I'm afraid of it, or I don't have a healthcare provider that's explaining it to me well enough.
Or I don't want to be, and I see a number of people, well, I'm trying to taper down because sometime I want to get off this.
Yeah,
And it doesn't work that way, folks. It'd be nice, but
yeah.
just
Another kind of question I have for you, or my understanding is that a lot of the stimulants are not tested on people older than their 40s. Is that
um,
true?
I think that often it goes up to 60s, but certainly not above that. And there's even more stigma, I think, in the medical community of, oh, you're 72. Oh, that's definitely not a good idea. It's going to be a problem on your heart or whatever.
Yeah.
Huge study in which was, I think it was 1.8 million people in the US, 2.1 in Denmark. So almost 4 million people looking at if someone had ever taken Adderall or a stimulant for anything and never taken it, and comparing rates of heart disease
Ah,
and
okay.
morbidity from heart disease. It was a minuscule increase with Adderall, like 0.01%, hardly any. So taking Adderall is not a long-term risk to your cardiac health.
Okay.
Not taking it, you're more likely to be overweight, more likely to have high blood pressure, more likely to have cardiac disease. So again, the risk of not being treated is higher than, in this case, a very low risk as far as heart health.
Yeah. And risk of accidents as well, and all kinds of things like that.
Absolutely.
Yeah,
And
premature death.
as Russell Barkley has done a number of studies, I don't think there's anyone better at looking at statistics and coming
Yeah.
up with an accurate statistical analysis that having ADHD is a risk factor for early death compared to those who don't have it,
Yes.
partly because of that accidents and addictions, which are more common in people with ADHD than not.
Yes.
So there's a lot of factors in there. And
Yeah.
certainly,
I would say I had the internalized stigma, and I tried medication, didn't like it. But I tried it for a week or two. And when I first got diagnosed in my 30s, and it took me 15 years to get medicated. And I will say at this point in my life, it is my biggest regret, because
mhm,
I did not even realize what I didn't know,
yeah,
or how
yeah.
much better things could be. So here we
And
are.
I wasn't diagnosed, hadn't been aware of the impairments I had
Mhm.
until I had a position as a physician clinician in an office and also as administrator of that same office.
Uh,
That doesn't work. I'd be walking into a weekly meeting thinking, oh yeah, agenda. I didn't do one of those, and trying to come up with it at the time just did not track on a lot of things. And at that point, someone suggested, well, maybe you want to see about ADHD. And I said, what? So saw a psychiatrist, and after an hour and a half, very extensive interview and all kinds of things, she said, yes, it's pretty evident you have an intent of ADHD. And my first question was, how do you get through med school with ADHD? She said,
mhm.
that was your hyperfocus. And that's
Yeah.
exactly right.
Yeah.
I just love the field of medicine. I love studying it. so I could put in the time and concentrate very well on that. Organization and planning, that's definitely not ever been a strong suit. So,
Mhm.
and starting medication certainly didn't make all that fall in line. It's learning strategies and keeping track of things and making
Yeah.
an effort to do that. And to bring it around to a woman with ADHD, even
Yes.
after diagnosed, say in her 30s, 40s, mother, maybe has a career, the time to incorporate, okay, some routines and have a way of tracking what's coming along with her kids, different ages, different sports, different school activities, and they have to be taken here and there. And I think that the solution I've heard that's most helpful is to have a whiteboard. Each child has a different color. Mom and dad have a color, and you have
Yes.
the sports and the who needs to go where.
Yeah.
And
Brilliant.
but
Yes.
that's a strategy, and medications, whether it's to the kids are taking medicine and mom is, you still have to have that basic strategy there. And maybe mom's the one who has to put that together.
Yes, often mom is the one to have to put
Mhm.
it together. Yeah, and
'Cause-
the other thing I would say too with women is often like what we're describing is emotional labor as well, right? A child comes home, they've had a tough day, some bullied. You're often carrying the emotions of the family, and this can really destabilize. Uh, and
Mhm.
emotional dysregulation is a real thing in ADHD.
And certainly neglected in any of the criteria.
And there's already a stereotype for women that were more emotional. So this
Mhm.
dysregulation makes it even worse or more shameful, maybe. Um, so I do hope going forward there will be more work on that, more recognition of the
Yeah,
emotion.
that definitely the mood stabilization. And a number of people tell me when I take my pick one, Adderall, methylphenidate,
Mhm.
Focalin, whichever, then yes, I'm more even. I'm not, my moods aren't up and down so much.
Yeah.
And that's helping smooth out that regulation.
Yeah.
And that's not because they're euphoric and feel great because they're taking something, but because their dopamine is getting to where it needs to, the communication between different areas of the brain is working better.
Yeah.
And so that mood isn't as volatile.
Yes. An ability to cope.
Mm-hmm.
Yeah. And
And,
I would say with the medication too, part of it is it also evens out your energy throughout the day, right? Depending on how long lasting it is, that I can get through a full work day, I can feed the kids,
mm-hmm.
or I crash, you know, after holding it together all day.
Mm-hmm. I'm looking at some of these questions that Sari Solden has in her questionnaire toward kind of a screening. It's not been validated and all those kinds of things as far as statistically, but it definitely looks at how the kinds of things that show up for women. And a woman looking at this and realizing, boy, there's a lot of things on here, may encourage that person then to get an evaluation for ADHD.
Mhm.
Things like do requests for one more thing at the end of the day put you over the top emotionally?
Mhm.
Are you clueless as to how others manage their lives on a consistent, regular basis? So
Mhm.
I think most people, it may look that way, but internally here at home, it certainly isn't that way.
Yes.
Um, do you start the day determined to get organized and at the end of the day feel defeated? because you haven't made the progress you had wanted to. Does time, money, paper, or stuff dominate your life, hamper your ability to achieve your goals? That I think is almost typical of anybody with ADHD, but I think that this is where the woman of the household may not always manage the bills and the money in terms of paying them, but she's the one who's more likely doing grocery shopping, keeping track of the money there, the paper and overload of paper and saving things. Yes, I need that, though it's a typical ADHD thing, out of sight, out of mind. You can have a great filing system, but yes, I want to be able to remember I have this. So it's the piling system on the desk.
Yes, externalizing the memory. Yes. Yeah, I think the stuff around money is very interesting. Likely for men as well, but the fact that men, we talked about this as well, make more than women consistently in this country. It's about 85 cents for a woman to every dollar a man makes, given the same job, same education, everything being the same. So we have less to play with, less wiggle room in terms of mismanagement of money. And most women I work with have no clue how much money they have or what they've spent in the last few days. It's almost like the equivalent of the time blindness, but with money. Just don't know. In the moment,
and
don't know.
And whether one has a budget, I've been thinking maybe it's better to almost do it in reverse, look back at bank statements, credit card statements. What did you spend your money on?
Yes.
And then that may be the awakening of, oh, I can't go shopping all the time, or I thought we had plenty of money and did this and that. Yes, but that automatic payment for the car insurance has to be able to come out of that. So looking at the balance in the account doesn't work, because there may be two other payments coming up. So looking backwards at where it went may help inform the planning of how much there is to go forward.
Yeah, and maybe it's kind of abstract the way we do banking now. You know, I use a card. I don't have any connection with what that actually means. So I will suggest to people they start using cash for a while. Stop carrying credit cards. Go to cash, feel it, and you're going to notice it more, what you're doing. You know?
I know one strategy on that is to have envelopes. This is the grocery money, the whatever, and you put the cash in there at the beginning of the month. And then, well, there's only $20. Well, I guess we can buy milk or eggs, but not both. And look in the, and that's, I don't think it's necessarily sustainable. Maybe it is for many people, but it can be a helpful awakening and a way to see, oh, this is where we're spending money, and no, there isn't any for.
The other area that is maybe more specific to women is that we're expected to look a certain way as well. So there's pressure to look a certain way, and you couple that with low self-esteem and shame, there may be more expense on that. And then you add on another layer of, I have sensory issues. I can only wear certain things, or I buy something and it doesn't feel okay, so I'm replacing it more. That I think that is often how women with ADHD get into a shopping habit. And it's a dopamine hit.
Yes. And I think most men would just be absolutely flabbergasted at the amount it costs for a woman to have her hair done.
Oh my
I mean,
goodness.
I can go in and get a $20 haircut. Great. Can you get your hair done professionally at a salon for even twice that?
Oh, it's 200. I'm revolting
Oh my
currently.
goodness.
I cut all my hair off because I'm saying no right now, but I likely will go back, but I'm saving some money in the meantime.
Ah, two.
Yeah,
See
it's
that?
so expensive. Yeah, 200. At the cosmetic industry, all
Oh yeah.
there's just so, and diet, people with ADHD are more likely to be overweight and binge eat. And then, what is that like for a woman?
Mm-hmm. And emotional overeating. Yeah.
Yes. So,
And it's certainly there for men as well, but I
yes,
do think it's more likely for women, and that the emotional overeating part
yeah. And
and restricting. And
yeah,
among girls who have ADHD, more have an eating disorder
yeah,
than among neurotypical girls in that same age range, uh,
and
which,
it lasts a lifetime too. I have had some clients in their 60s with um, a spike in their eating disorder again. And, being anorexic again or bulimic. And but it's something we think of as a youthful problem. It is not. It doesn't go away.
no, and bulimia particularly, and
Mm,
anorexia is a much higher risk for various things that would end one's life sooner. Bulimia and obesity and heart disease and things like that. Uh, but it's definitely a health risk, and it very, very rare in men. Haven't seen any statistics on ADHD and eating disorders in men, but there's very few reliable statistics on eating disorders in men anyway.
yes, yeah, and perhaps needs to be much more research in that area. I know it occurs for them too, but maybe
Mhm.
not at the rate it does for women because they don't have the pressure women do in the same
Mhm.
way. Although
And
it's coming, and I see it, with the six
mhm.
packs.
Yeah, the pressure to look, keep up with looking good. Um, another, in this, maybe an indirect part on that female ADHD tax, and I have not seen anything on whether it's more common in women with ADHD or girls with ADHD, but social media,
Mm,
self-diagnosis, and so
yes, I'm glad you're
again,
bringing
it
it up.
becomes
Yes,
if, oh, I must have a tic disorder because I saw this on TikTok. Well,
yeah,
that person doesn't know anything about it necessarily. Oh, and so I have this disorder, and that gives that person more social standing in their social media groups. Um, and yet, go to a physician that would say tic disorders don't all of a sudden rarely start when you're 18, and they aren't a 4-step kind of sequence of things. It's clearing your throat
yeah,
or something pretty simple. And there are
yes,
other diagnoses that come in there that I guess more exotic ones, dissociative personality. Oh, I have multiple personalities, or one thing. Um,
yeah,
and it is certainly depression is much more common in people who use screen media all the time. Think the social media things as far as TikTok, Instagram, and bunch of other things that never heard of, but they're out there. As far as comparing yourself and feeling down, you don't have this, you aren't like that. And yeah, I think men do too, as far as you don't have a six pack and you can't lose 40 pounds in 40 days, whatever, which is all usually hype and sales stuff to get you to buy some vitamins, something. But the incidence of suicide is higher in girls using the social media things. Are girls with ADHD more likely to use the social media? Certainly more likely to commit suicide.
Yes. It's not,
And more than boys.
it's very scary.
Well, I'm sure we could talk for another hour or two. But we've had a good conversation about the various factors that go into the female ADHD tax. There's no doubt that ADHD has a lifelong effect on men as well, but it's much higher and more severe on women with all the responsibilities a woman has in terms of running a household, managing children. The male in the household is often, that's the person who's usually always has a job. That woman may or may not. But the burden of running the household and the executive function demands more often are on a woman in a relationship. And that costs a lot as far as loss of self-esteem if she can't keep up, and all kinds of different things. So it's been fascinating to talk about this with you, Deborah. Thank you so much for coming on the show.
My pleasure. Great to spend time with you.
This is Dr. David Pomeroy saying so long for now. Glad you could come join us and look forward to having you join us again.